Good morning, everyone. I'm Steve Rosansky, President and CEO of the Newport Beach Chamber of Commerce. Excuse me, got to get my little script here. And I want to welcome you to the very first edition of Update Orange County. Update Orange County is a collaboration amongst the Chambers of Commerce from Newport Beach, Costa Mesa, Santa Ana, and Irvine, as well as the South Coast Metro Alliance around the South Coast Plaza area. Our goal is to bring you quality programming to help you successfully run your businesses and to keep you informed as to current and future business environment. Today we have with us Orange County CEO Frank Kim, and he's going to update us on the state of the county as well as the county vaccination program. After Frank delivers his presentation, he'll stick around for a while to answer questions. If you have a question for Frank, please put it into the Q&A box. That's where we'll be monitoring for all questions today. Just a couple of quick facts on Orange County. I was checking on the OCBC annual report that they put out. It said that Orange County is the third largest county in California and the sixth largest in the nation, which is incredible if you think that there's probably, I don't know, 20,000 counties or something. I don't even know how many counties there are. Maybe Frank will tell us. We also have more residents than 21 states, and our economy is probably larger than about half the states in the country. So Frank has got an important job. He's probably manages more people and more business and more residents than half the governors do in the United States. And if you think about it, he gets probably a lot less recognition than they do. I don't think Frank's been on CNN recently. So I'll just quickly read Frank's bio, and then we'll turn it over to him. So it says here, Frank Kim was appointed County Executive Officer by the Orange County Board of Supervisors on May 12, 2015. Frank brings to the CEO role more than 25 years of experience in planning, organization, and direction, team leadership and supervision, program development and management, and financial services. In his role as CEO, Mr. Kim, in collaboration with the Board of Supervisors, we've got to make sure that they get their due, and the executive management team, is responsible for the county's $7.6 billion, 23 department, 18,000 position budget. Prior to serving as CEO, Frank has served the county as the Chief Financial Officer, Director of Administration and Finance for Orange County Probation Department, CEO Budget Team Manager, and Interim Reuse Manager at the former Marine Corps Air Station at El Toro. He joined the county in 1995 as a staff accountant, and Frank held positions in private industry and higher education before embarking upon his county career. So obviously Frank's, he grew up here with the county over the last 26 years, and he's done an excellent job as we can see from the figures that I mentioned earlier. Frank currently serves as president of the California Association of County Executives, and he holds a Master's of Public Administration and a Bachelor of Accountancy from Cal State Long Beach. So with that great resume behind you, I'm going to turn it over to you, Frank, and you can give us the state of the county, the state of our vaccination program, maybe talk a little bit about homelessness. I think that's a big issue that concerns a lot of the residents of the county, but the businesses as well, because we've seen a lot of homeless move their encampments into areas that traditionally they might not have been. And so if you cover some of those topics, and then we can open up for questions afterwards, we'd appreciate it.
Well, thank you very much, Steve. I appreciate the invitation and a chance to meet virtually with the wonderful members of the Chambers of Commerce. So I appreciate that. I've been really fortunate in my county career to have been involved in the senior management of the county government during some really interesting times. When I was the Chief Financial Officer, we went through the Great Recession. And then I came into the job as the County Executive Officer, and we went right into what never let up, but it's the homeless crisis. And then we transitioned very smoothly into a pandemic response. So it's been an interesting few years here in the county. But let me first start with an update in terms of how the county is doing. And as a former finance officer, I like to look at the numbers. Looking at the county, our financial condition is actually still very strong. The county has approximately a $7 billion budget, but the vast majority of that are entitlement programs or funds where we provide services on behalf of the state or federal government, and then we're reimbursed directly for those activities. The actual kind of a core piece of local government responsibility that we fund with local sales taxes and with property tax, the real taxes that our residents and businesses pay. That really is a smaller segment of that $7 billion budget. Only about maybe 1 billion or so is the size of our general fund. And that's primarily funded through property taxes. And I think, as most of you know, property valuations continue to grow, and particularly residential properties. So our revenues are looking fairly strong there. In terms of sales tax, as I was chatting with Steve, I looked at the year-over-year numbers, and we're only down about 1%. So while we had a fairly aggressive fall off at the very beginning of the pandemic, most of that seems to have recovered. Now, I know a lot of that is also tied to joblessness and what may happen here in the next 6 months as related to how businesses adapt to reopening or the lack of reopening, and how the economy is able to recover under the various state and federal rules that are in place. So that's always a challenge. In terms of the county's fiscal position looking forward, we're right in the middle of our budget development process. What I can assure you is that the county absolutely has made a commitment to support our core infrastructure. And what that means is it's public safety, it is our streets and roads, it is that basic infrastructure that I know all of our businesses and residents rely on. I don't see that necessarily falling off. In fact, year over year, the county has continued to devote the vast majority of our discretionary funds to supporting that basic infrastructure. So things like our roads, those are funded through gas taxes. And while those have come down, we are in an okay position to continue maintaining a current level of service. Our flood channels are funded through property taxes. Those are doing quite well in terms of revenue. And our financing structure, our public safety departments, the largest funding source is public safety sales tax, which is a 0.5 cents tax measure in Orange County. And that, again, is doing much better than what we anticipated in our budget. And what's not covered through that measure is supported through our general funds. And our board historically has been a very strong supporter of public safety. So I don't expect that to change in the upcoming budget cycle. One of the challenges, as Steve had mentioned, is this concept of how do you address homelessness? And that is just not a simple answer. The real challenge there is that over the last 10 years, counties and cities have spent a significant amount of their resources investing in homeless shelters. Historically, counties and cities have left that responsibility out to nonprofits. And over time, there's a fairly good infrastructure for family homelessness or homelessness for at-risk women, et cetera. But for the general single adults that are dealing with substance use and other challenges, there's not been a real strong infrastructure. And over the last 10 years, you've seen a lot of cities come together, and the county as well, and build larger scale shelters that can provide a more structured environment for those individuals. So Placentia, Anaheim, Buena Park, a lot of those cities have come together and co-funded and co-developed homeless shelters, sometimes with the support of state funds and or county support. We know here locally, with respect to your region, my understanding is Costa Mesa is establishing their program, and the city of Newport Beach is participating in co-funding a portion of that to share resources. So that regional approach, we know, has been the most effective because homelessness has no border. And the real challenge for us is instead of playing whack-a-mole, trying to deal with it in one area, trying to develop larger regional responses to homelessness, we found to be more successful. The real challenge that we've had in that is that there's been a number of lawsuits, particularly with the county and with other cities, related to enforcement of homelessness. And while that's been a challenge, there's a little bit more clarity in terms of how we can operate in that environment. The county and many of the cities in central and northern part of Orange County are currently in a settlement agreement with the federal judge, Judge Carter, which I think many of you know or have read about. He is a very strong personality, I would say. He definitely has strong views on what is allowed in terms of enforcement and what is not allowed. And that has essentially shaped the response. And most cities have shared a similar view as the county, in that if you don't have an available bed that you can offer, then enforcing loitering or camping in public spaces is very difficult for your local jurisdiction to do. And so that is why I think that you've seen more of an interest in local jurisdictions to invest resources to build out shelters. Not only is a shelter a better location to attach these individuals to services and also to help them recover in terms of any physical or mental health challenges that they may have, but it is also a tool that allows local jurisdictions to be able to offer these individuals a different location or a place to address their physical and mental health challenges. In support of that, the county also recognizes that kind of substance use, mental health challenges, those types of physical challenges in Orange County, we've not had a great infrastructure in terms of how to address that. Whether you have private insurance and you live in a very good community, or you are dependent on the government to provide your medical response. And to provide kind of a no wrong door solution, the county is embarking on a process to build out our mental health infrastructure. And this is not just for homeless individuals, but it's also for anyone else in Orange County, regardless of your insurance situation. So you may have heard about our program in Orange. We call that our Anita Be Well program. But a location like that will allow for not only temporary, but kind of short-term residential stays to help address behavioral health issues and substance use and other challenges. In the past, a lot of that kind of intensive treatment occurred outside of Orange County. So when we needed to treat those individuals, we would send them to Los Angeles or other counties where those kinds of programs existed. And that really is not appropriate for a county of our size and stature. We need to have these kinds of programs available. So we are working on multiple locations. Our goal is to have at least 3 of these facilities up in Orange County. So the one in Orange has just begun operating. We've got a site identified to provide a similar program, but in an enhanced way, not only for children and adults, but also other kind of recovery type of programs that really will work in harmony with our public health infrastructure. And that next site we're working on will be in that Irvine area, and then we'll work on another location after that. So there's quite a bit happening in terms of mental health and homelessness, but I don't think there is a one-size-fits-all or a quick solution that I know a lot of the residents would like to see. And it's just a challenge of dealing through the local courts, as well as the federal court, as well as all of the things that go along with why an individual becomes homeless or becomes an addict and has substance use or mental health challenges. Those are long-term treatment programs, and it takes time and infrastructure. And at least I'm happy to say that we are on the path to building that out. It won't happen overnight, and it will take many, many years, but we certainly have a playbook and support of our local communities. So that is working through its process. What I can share with you on COVID, because that does dominate a lot of our daily work, is that our numbers are looking much better. If I look at a comparison of Southern California counties, Orange County has the lowest case rate per 100,000. That is a metric that the state looks at to see on a weekly basis how many individuals per 100,000 residents test positive for COVID. So in Orange County, our number is down to 7.4. That's a really low number comparison to where we were several months ago. At our peak during the holiday season, our number was 79. So that's come all the way down to 7.4. So that is a significant improvement, and we're leading Southern California. Los Angeles is much higher than us. Riverside's around 11, San Bernardino is 9, San Diego is approximately 11. So our number sitting at 7.4 is a very good number, and it indicates that even though Orange County is the third most populous county in California, we're about 3.2 million people in 800 square miles. We're a very dense county, and density is one of those factors that increases or exacerbates COVID transmission. But our number is very good. We're very close to that red tier. The cutoff for a red tier is 7.0, and we're dropping around 0.5 point a day, although there's been a bit of a plateau over the last 2 days. But that number is trending toward red, and I would expect that we will see red tier next week when the state updates their weekly numbers. They post them on a Tuesday using Sunday 7-day data. So we'll have to see what it looks like. It's not a promise. I don't have a crystal ball, but if you look at the current trends, it's likely that we'll be below 7 by next week by this Sunday, this upcoming Sunday. And so if that's the case, then we meet one of the 3 metrics. The other 2 metrics are also looking very good. And the second one is a testing positivity rate. We're at 3.9%, and that is actually in the orange tier. So that's 2 tiers below where we currently are. And then the third metric that the state looks at is a health equity number. And they look at the zip codes that are in our lowest health and poverty rate areas, and they look at the test positivity rate. That number is 5.0, and that is also in the orange tier. So based upon the daily numbers that we're seeing, it's looking very positive. And as long as those trends continue, I would expect that we have a good chance of seeing red tier next week. Now, one thing that's really important to recognize is that once you meet the criteria for red tier, you've got to stay in that tier for 2 consecutive weeks before the activities that are allowed in that tier are allowed to open. So it's really a 3-week process. You've got to make it in 1 week, and then you've got to hold it for 2 weeks, and then you can open. I apologize for how confusing all of that is. I'm sure many of you are aware of that, but those are the state guidelines, not the local guidelines. And we have many conversations with our residents weekly related to how we manage those criteria. We don't have local control other than the fact that the state says that we can be more restrictive. We're not allowed to be less restrictive. So that's a challenge for us. But once we meet red tier, a number of things open. Retail goes from 25 to 50% of capacity. Movie theaters can open at 25%. Restaurant indoor can go to 25%. Gyms are at 10%, et cetera. Bars are not open until orange tier, so I apologize for that, but those are all the rules that the governor sets. My understanding is that they're looking at relaxing some of those rules, but as of today, I don't know what that looks like. So I think for us, all we can do is what we're doing, which is test. The reason why testing is important is that if individuals have COVID-like symptoms, get a free test. We will FedEx you a take-home kit, a nasal swab or an oral swab. You can come to our drive-through sites. We've got stand-up kiosks that you can access. All of those are free, and you get a result within several days. And we encourage our residents to participate in that. Additionally, I know there's been a number of questions related to the vaccine rollout. I think that's running much better today than it was initially. It's a tremendous logistical lift. That program, each one of our pods takes about 150 to 200 employees to operate. The real challenge for us has been the lack of vaccine availability. We know that yesterday, President Biden indicated that we would be overrun with vaccine, and anyone that wanted one could get one before the summer. I hope that's true. What I can share with you is at our level, we've seen our weekly first dose allocations grow around 10% over the last week. So that's going from the low 40,000s a week up to the high 40,000s a week. It's not a material change so far. That's going to make a difference in the numbers that we truly want to vaccinate. Many people have had questions. Gosh, Frank, when is the county going to open the next pod or the super point of dispensing location? And there's been a lot of media coverage over the Orange County Fairgrounds. That is one of the locations that we have an agreement with. The simple answer is, when I have the quantity of vaccine that allows me to open a site like that, I will do it immediately. The real challenge is, I think this week's allocation is around 45,000 vaccine. To run a program like that, I need at least 4,000 to 5,000 vaccine doses a day. And I want to run that 7 days a week. So you can do the math. I need another at least 30, 35,000 vaccine doses weekly. When that happens, we will open, whether it's the fairgrounds or other locations. We have several under contract. You will see us regionally open additional vaccination locations. I can also share with you that the national retail pharmacies are now vaccinating approximately 100 individuals a day. That's Rite Aid, Walgreens, CVS. If you go to our website, ochealthinfo.com, we have a link to all of the health providers and all the national pharmacies where you can make an appointment to get access to vaccine. So what I expect is that over the next 30 days, you'll see a significant growth in the number of vaccination appointments that are available. Right now, the real challenge and the complaints that we've heard are about the county's Othina system, primarily because at any one time, we're opening anywhere from 10,000 to 12,000 vaccination appointments. And there literally are about 1.5 million people that qualify under the current tier that want access to the vaccine. And that's been a real challenge. So that's happening. I see there's a number of questions that have been posted to the chat. So let me try to get to a couple of those, and then we'll see if there are any other areas that you'd like me to expand on in more detail. So the first question is, can we use the excess public safety dollars to open the drop-in shelters? The answer is no. The public safety sales tax dollars that come in are restricted. It was a Proposition 172, sometime around 1994, I want to say, and it restricts the use to the district attorney, sheriff, ocean lifeguards, and for firefighting. So we can't use those dollars specifically from the county.
You know, before you move on, Frank, one of the hot issues last year, certainly, and I don't know how it's going to play out this year as municipalities and governmental agencies are figuring out their budgets, but there was that whole defund the police movement, which really wasn't meant to defund the police department. I think it was meant to allocate more funding towards alternative ways of dealing with crime, especially people who were suffering from mental illness or things like that have got involved with the police, and maybe that the methods that the police use were not the best way in every instance to handle that situation. So is there any thought about that, additional money towards those types of programs?
In fact, what I would say is we're actually doing that. So when we devote general funds or other county resources to opening the Be Well clinics, the first one in Orange at the Anita program, that is exactly what I think those individuals are talking about is there a way to address treatment rather than just enforcement and then transferring people into a jail setting? So what I would say is that really is an outpatient type of model. Once you're in the jail system, which I know a lot of the advocates don't like that, but we have a new jail expansion that is opening out in our Music jail facility, and there'll be 700-800 I think beds there, and we are currently programming that for a lot of the treatment models, because if you're with us, you might as well get started on your treatment and then have a warm handoff to an outpatient type of a program. So this concept of treatment, whether you're in custody or out of custody, that's been a primary focus, not just of Orange County, but in other counties. And again, some of that is driven by not only need, but there's a lot of litigation on that as well. So our chambers may not be aware, but there are groups like the Prison Law Office, others that it's a full-time job of going around and monitoring treatment services within jails and filing litigation. So across the state of California, you're going to see a lot more behavioral health and substance use treatment within a custody setting. And you're also going to see a significant investment in non-custody. So whether that's a day reporting center, whether we are embedding behavioral health clinicians into law enforcement departments, we're working on that pilot, and creating other out of custody type of programs, not only for those that have had trouble with the law, but also for those that are just our everyday community members. So there's a lot going on.
Great. Sounds like we're ahead of the curve on that.
Then the second question I had was, can you confirm that we are officially entering eligibility for red tier yesterday? The answer is no. Yesterday, because of a couple of things. There's two paths into red tier. One is if our case rate were below 7, we could have been day one into red tier and start that 14-day or 2-week time period. So our number was 7.6 based on the state data. And so that does not qualify you for red. The other way that you can get there is if your health equity number is 2 tiers below, then you can qualify to accelerate into red tier. But there's another state qualification that it can't just be 2 tiers below. Your health equity number has to be below 5.0. Ours was right at 5. And in fact, it was slightly over 5 and they rounded it down to 5. So we missed the criteria by like 0.1% on testing. So that's why I say it's likely next week we would see day one in red tier, but we did not make it yesterday.
Can I just follow up on that? So
yeah.
A couple of things. So we're, I know, especially like our restaurants and, hospitality type people, they're all over, moving down into the next tier, opening up indoor dining especially is important. And so taking that second scenario where let's assume that the health equity index will move below 5. And so we will be solidly in the orange tier there. You're still not going to be able to jump down to the orange tier, right? You can only move 1 tier at a time. That's my understanding of it. Okay.
Yeah, if your equity is 2 tiers below, your overall county can come down to 1 tier.
Okay.
I have no idea why this has to be so complicated. Again, these are state guidelines, and I suspect that with the vaccine rollout occurring at a very robust pace, I would expect the state to make another modification to ease counties moving into red tier, but we don't know what that looks like yet, but we know those conversations are happening.
And then along that same lines, let's, when we were talking about the case rate, And we did just miss moving into the red tier on the case rate. But my understanding of it, and you're saying something different, so I just want to be really clear on it. I thought as long as the case rate was published 2 weeks in a row at whatever tier that was, that's the tier you're in. Not that once you hit it, you have to wait 2 more weeks before you can implement. So basically so is that?
No, there's a 14-day clock. Once you meet the metric, you've got to be in the metric for 14 consecutive days. And then on day 15, you can drop and open all the activities that are in that new lower tier.
So they don't take the lag week, I mean, because it is a lagged index.
No, so technically it's a 3-week period. You've got to make the number technically for 3 weeks.
So all right, so if we make it on the 9th, it'll be the 23rd, you're saying, before the red tier will be implemented. Okay, that's
exactly. No, I don't know why we got to make it so hard. It just is.
Well, it's government, that's why. Isn't it? I guess it's part of the, I mean, in fairness, or for a reason, I think it's the government or Governor Newsom or the California health officials are kind of wanting to have a break on the thing and not just keep jumping from one place to another, kind of easing into things, not rapidly reopening. So I guess there's some logic to it, but it is frustrating for, I know many of my business members, and I'm sure the other chambers feel it as well with their people, that they're ready to reopen and bring customers back in, but we have this kind of drag on the approval process that allows that. So okay, thank you, Frank, for clarifying that.
Yeah, I mean, I think one of the good news items that we've had is that because Orange County's performed a bit better than our peers in Southern California. Last week Friday, we were able to open youth sports. And I know that's been a big relief valve because a lot of parents are very concerned about their kids being cooped up and not having access to their soccer or football or basketball programs that the kids are used to participating in. So that's been really a welcome relief valve. And I wish more could happen, particularly to businesses. I know our board's always been business friendly, and that's why we haven't been more restrictive than what the state allows.
Well, that certainly leads into this next question here. Do you have an update on the Orange County Public Schools being to fully regain?
So I don't remember the exact date when in-person schools, essentially by the governor, are required to be reopened. I don't recall the exact date, but I can look that up and obviously I can send that to you. But this last week, the governor essentially cut a deal with the Teachers Association labor group, as well as with administrators that operate public school systems in California. And the governor allocated $2 billion of state funds to provide not only access to testing, but also contact tracing and PPE and other resources that allows schools to more safely reopen in-person education. Additionally, the state required that counties allocate 10% of your base vaccine doses to schools. So in Orange County, as an example, if we're getting 45,000 first dose vaccines this week, 4,500 of those we're going to give directly to the Orange County Department of Education. The OCDE then has set up regional pods to vaccinate teachers and administrators. So that is happening this week, and that will help. Not only will schools get access to those resources for testing and all that, they also will get priority access to vaccination. So the county won't be doing those vaccines. We simply will be taking a portion of our vaccines and then giving it to the Department of Education. Mm-hmm. So that's already underway.
Very good.
And then next question we had was, we've heard that reaching at least 70% immunity is the goal. Where are we at? Well, I think we still have a ways to go. What's difficult is immunity is, you can count that, or you can measure it in a number of ways. One is that you may have had COVID and you have the antibodies, or secondly, you have received the vaccine and your body builds those antibodies and that protective response. We don't know. We don't have a good idea in terms of how many people in Orange County may have had the virus and then essentially passed it without seeking treatment or testing. So getting an exact number is very difficult, but what we do know is that the Pfizer and Moderna vaccines their efficacy rates are in the mid 90%. And Johnson & Johnson, which the FDA had rated at 72%, is still excellent and is 100% effective at keeping you out of a hospital bed. So I think the most important thing for us is to quickly vaccinate as many people as possible. Obviously, that's the preferred way for an individual to get immunity, not necessarily by contracting COVID. I've had it; it's horrible. So our goal really is to work 7 days a week and quickly vaccinate as many people as possible. And what we're really happy about is that the hospitalization rates have dropped dramatically. And because they've dropped dramatically, hospitals now have more resources. And in my discussions with local hospital CEOs, they've indicated that they're 100% invested in getting into the vaccine game. And that's really important because many people have underlying health conditions, or they've got questions. They may be immune compromised, or they may be going through cancer treatment. And they come to our pods and ask, is it safe for me to receive the vaccine? And that's not a simple answer. We have physicians that will help you, but the best way for individuals with compromised health systems or going through some kind of treatment is to have that conversation with your own primary care physician and then receive that vaccine through your traditional healthcare delivery system. So we're happy to stand up these pods where we're doing, at our peak, we did almost 12,000 vaccinations a day when the vaccines are available. Hospitals, I don't know, will do that quantity, but if everyone can grab the rope and pull some of that, I think we're going to get there faster. So we're really excited about the federal government distributing more vaccine to the pharmacies, as well as the state distributing more to our traditional health delivery system providers.
As a follow-up, are we going to be seeing the J&J vaccine here in Orange County?
We believe so. So we were told that they had started shipments. Now the state has not contacted us to indicate how many vaccines or when Orange County will receive the J&J, but that really is a game changer in that it's a single dose and you don't have to store that at ultra low temperatures. So these ultra low freezers are about $10,000 a piece. And so a lot of the small community clinics that are part of our robust health delivery system in Orange County, they can't afford $10,000 to buy these specific freezers. So when you get access to something like a J&J, you don't have to worry about scheduling the second dose appointment for individuals. You can just have a normal pharmacy kind of refrigerator freezer, and it's a lot easier to manage.
I know one of the issues that some people have is they have a preference of whether they want the mRNA, Pfizer, Moderna, or the J&J for different reasons. I mean, some may be that it's the one dose is great. I don't have to go, one and done, and I get the shot and I'm out. The others maybe look at the efficacy rate of some of the other vaccines and say, wow, I'd rather have the 95% stuff instead of the 72% stuff. And so is there an ability for, because I think when your appointment comes up, they basically assign you to a facility, and whatever they're dishing out at that facility, that's what you get. Is there now, or will there be an ability for people to direct which type of vaccine that they want to receive?
Now, I can't answer that question for the pharmacies or for hospitals because they'll use their own model. But I know from the County of Orange, we're working on a vaccine kind of fact sheet so that you can look at Pfizer, Moderna, Johnson & Johnson, and understand the different efficacies and the facts that have been provided to us by the FDA and CDC. And then our goal will be to identify which clinics are providing those vaccines, and then ultimately individuals can self-select. At least that through the county side. That is our plan. I can't make that promise 100%, but that's likely what we're going to do.
Well, certainly I think it's a good goal because you want as many people to get vaccinated as possible. And if they're not getting vaccinated because they don't want to take the J&J, and they're willing to wait for the other one, let them wait for the other one, is my belief. As long as they're willing to take a vaccination and get to that 70 or 80% that we need, for the herd immunity, I think that would be a smart policy for the county to follow. I was going to ask you one other thing, but I can't remember. So let's move on to the next question. If it comes back to me, I'll ask you that.
Sure. So the next question is, assuming a best case scenario that we move through the tiers, does the county have an internal plan around when they start issuing permits for events and large community happenings? Well, the real challenge in all of this is that state's got another rule for us. So when you look at the state criteria for what's opened under what tiers, when you look at things like mass gatherings, they don't happen until orange or yellow tier. So as an example, large theme parks, I'm thinking about Disneyland, Knott's Berry Farm, those are not open until we hit yellow tier. And then even at yellow tier, they are 25% capacity. So we've got, I think, at least another month, maybe more than that, before I think you can even look at the possibility of us getting to that yellow tier. Now, what I'm hoping is that vaccinations accelerate and perhaps the state will rethink those metrics and perhaps ease our entrance into them. But those kinds of large gatherings won't happen until orange, and then many of them not until yellow tier. So sorry about that. We'd like to see that change. I don't necessarily personally believe that that is the best policy, but those are things that we've got to work through with the state. So we do have regular conversations with the governor's office, and we do encourage them to reduce those kinds of restrictions, because one could make the argument that, hey, if you can prove that you're vaccinated, right, and you can prove that you've had a recent test, if you can get on an airplane, if you can travel, why can't you go to a theme park? And I don't have a good answer to those kinds of questions. I get them daily.
Well, yeah, and I think it's just frustrating when you watch the news and you hear, like yesterday, the state of Texas is wide open now, no mask requirements any longer. Florida has pretty much been there for months now, as they've taken a different attitude. Not that I think we've had the wrong attitude here in California, because I'd rather err on the side of public safety myself. And if I got to wear a mask, it's not that big of a deal, really. But to protect myself and protect others. But, they see that. I know Disneyland, I mean, that's the largest employer here in Orange County. You're talking about, close to 100,000 jobs, I think, and if you think about the stuff, all the businesses that feed into Disneyland, the hotels and the restaurants and the companies that deliver things there, it's a huge part of our tourism economy here in Orange County, and it's a big hole that needs to be filled. So, even if they could operate on some level, that would obviously be, I think, beneficial, for us, assuming they're willing to do that. I understand that maybe it doesn't make sense to open Disneyland at 25%. I mean, you just can't operate profit. I know restaurants can't operate profitably at 25%. I'm sure Disneyland has a big, big nut there with salaries and other things, that expenses. I know the governor seems like he's had no problem over the course of last year modifying the rules when he thought that they needed to be modified or they were in the best interest. So hopefully he'll be looking at that, as you just mentioned, and we'll see a little bit of relief from that.
The next question we had was, who sets the policy for self-quarantining when traveling out of state? What I can share with you is that local health officers do have authority to set quarantining requirements, but the state also has that authority, and I think the federal government also has that authority. So the answer is not so simple in that it's everybody. So the governor, through the state health officer, can set a quarantine requirement for California, and our local health officers can also provide some restrictions on travel as well as quarantining. But I think when you get to a question like with spring break coming around and families traveling, is that something that schools decide individually? No. So that authority would fall on your local health officer or the state when we talk about Orange County. So I know that Dr. Chow has weekly calls with the school districts, and if that's a concern, I'm sure that they'll bring it up during their weekly phone calls.
I would imagine that private schools, I don't know that they could have a less restrictive quarantine requirement that the state requires, but they might be able to have a more restrictive. Is that accurate?
Yeah, I mean, I think, right, if you're a private entity, you can set your own particular rules as long as they're not less restrictive than what's allowed. So I think that's always the confusion. And it's a very good question, is who has authority to set what policy? And generally, the state has always indicated that it's their rules. The health officer really, if you look at the statute, derives all of his or her authority from state statute. So Dr. Chow gets his authority from the state. And so because of that, we've got to follow the state guidelines. And the state has indicated through their emergency orders that we can be more restrictive, but not less restrictive. All right, the next question we have is, do we have variant viruses here? We do have some. We've seen reports in Southern California of the UK variant, as well as other variants that exist. There's a California variant, et cetera. At least I'm not a medical professional, but just from being in the conversation, I know that the virus it mutates regularly. Most mutations are not harmful, but some mutations can make it more easily transmittable or potentially more aggressive in terms of how it can affect a human person, a being, in terms of their physical health. Southern California, and maybe even the US, there's so much travel that is happening, even with the various restrictions, that I think if there's been a variant I know the UK variant there was one in Big Bear, Los Angeles, San Diego. It's here. People travel, and it's every hospital and the counties are so busy that I would say that they're not at a place where they're examining all of the kind of virus data and doing that scientific research. We know universities are looking at those things, but essentially most of us have been in a crisis mode, standing up testing, vaccinations, and then dealing with a lot of the other issues that come with dealing with COVID. And I think the goal is there will always be variants. And instead of worrying about the variants, let's get everyone vaccinated, because once you starve out the disease and it's gone, we don't have to worry about variants. So for us, that's been our primary focus. The next question is, well, at least it's a comment, that theme parks are open all around the world. That is true, that there are other communities that have opened those theme parks. And I think that's been at least one of, I don't know if it's a fair criticism or not, but it's been one of the kind of resounding themes that county elected supervisors have had in terms of a conversation with the governor is, are you looking at other states that have been more broadly open than California? And are you looking at their epidemiological history and records? And if they have been open and their case rates are not more significant than in California, do you need to modify your policies? So those conversations are happening, and I'm certain that the state's medical professionals are looking at that, but we've not received any direct feedback that anything is imminent. The only thing that I'm aware of is that they are looking at how does wide-scale vaccination factor into the various tier openings that are set by the state. And at least my understanding is that there is an interest or a thought within the state of reducing or accelerating access into the tiers because of the vaccination efforts that are ongoing.
The last question is just a comment that thanking you for being here. I just had a couple other quick questions if you got another couple minutes. Maybe going away from the coronavirus situation, but back more to the budget, because you talked about sales tax revenues being fairly stable, maybe down a hair, but pretty good. Property tax revenue is probably going to offset the loss in sales tax revenue as prices of real estate have skyrocketed, and you'll benefit from that. But what about, I mean, that's just part of your budget. Obviously, you probably get huge, sums of money as transfers from the state. So what about things like gas tax or money for education? I mean, do you expect the similar levels of funding there that your budget's going to be relatively unaffected, or are we going to stop seeing road maintenance or things like that that the county might do?
No, I think that's a good question. In terms of funding for education, that's a separate entity. So the state funds schools directly. So we don't get too involved in that. It's a little bit of a complicated formula. So essentially, the state is required to provide equal funding to all public schools. So let's say that, I'm just going to make up a number, that every kid gets access to $100 worth of education funding. The first part of that bucket is filled with county property taxes. So we fill slightly over 50% of that bucket. And then whatever is required, the state general fund comes in and then fills it to the top. Mm-hmm. So in terms of funding local schools, I don't expect that to necessarily change. I don't know from a statewide perspective how the response and reallocation of resources to COVID is going to impact the funding for teacher salaries or school capital improvements or other educational programming. I suspect that there is some impact. I'm just not familiar enough to speak on that with a level of authority. In terms of looking at other revenues that the county receives, in many cases, we're seeing more revenue. And it has to do with at least some of the political changes in Washington. A lot of what the county does is related to entitlement programming, whether it's CalFresh, which many people know as the food stamps program, or affordable housing, the Section 8 housing vouchers. A lot of those programs, they can increase or decrease based upon what eligibility criteria are set or what the level of funding is from Washington. And with the Biden administration, at least what we're hearing is that we're going to see increase in access to those types of funds. So for those entitlement programs, we're seeing some growth. For other programs, we're seeing it's a modification. How do I describe it? It's complicated. So some of the programs like gas tax are really driven by user demand, right? Because you pay at the pump. So if you are not traveling or using your car, the gas tax rate, the actual tax percentage is not going to change. At least that's my understanding.
Right.
But if there's a lower volume of consumption, the overall funding level is going to drop. So I would say that you can expect to see a decline in gas tax revenue, but it doesn't mean that you're going to see a decline in your actual maintenance, because most government entities like the county, we have a certain amount of reserves, and we're gonna look at that and say, is this a permanent change, or do we just see a one-time or a 1-2 year decline? If it's a 1-2 year decline, most of us take our reserves and try to smooth out that impact. And so if we recover in terms of our consumption levels, I think you'll see most entities try to bridge that road fund gap with reserves. But if it's a long-term reduction where structurally everyone starts to stay at home longer and not commute to the office on a daily basis, I think, yeah, it's going to have long-term impacts, but we won't know that. But then it's also balanced with fewer cars on the road, reducing the deterioration of the road. So I don't know today how to balance that. What I can say is in the short term, you won't see a decline, but if it's a long-term issue, you likely will.
Okay, so and I'll just conclude with a question that I asked the candidates running for the second supervisor district seat at a candidate forum that we had about a month ago. And the question to them was whether they support it or not, but I'll just ask you as far as do you think that's something that we'll see on the Board of Supervisors calendar? The issue of hero pay. So like for instance, in Irvine, they've just voted in hero pay for $4 or $5 an hour, I think, for certain workers, especially like grocery workers or retail type people. I know other cities have looked at it and are approving. I think Santa Ana also has hero pay. So is that something that I imagine that you only control the retailers that are within the county, unincorporated areas, not within the cities, but there are, like up in Rancho Santa Margarita or Coto de Casa or wherever, there are swaths of places where you do have some control. So is there any move at the board level to do something like that, or is that a non-issue?
I personally have not had that discussion with my board members, and I think that's really a policy question, not necessarily an administrative one in terms of anything that I would directly be involved in. If the board directed me, then we would draft an ordinance or a resolution, whatever was legally required to implement that. But I've not had that discussion, so. I know historically, not talking about the hero pay policy, but historically board members have generally allowed, the cities to administer what is within their jurisdiction. So I don't know that we get involved in that, but I don't think that's a question that is within my level of authority to answer.
Great. Well, we really appreciate you taking an hour out of your busy day. I know you have plenty of things to be doing over there at the county these days, but to inform our members and get us up to speed on some of the current issues that are facing businesses here in Orange County. So I'll pass that along to my supervisor friends that you're doing a great job. They should give you a raise. How about that?
That's all right, but I think I can thank you for inviting me to this event, and I know that we look forward to having a second district supervisor very soon. Election is March 9th, so I can't advocate for any candidate. We encourage everyone in that Newport, Costa Mesa area, Huntington Beach, to come out and vote, because it's important. Historically, we see kind of low turnout on special elections, under 25 or 30%. We'd love to see a robust turnout so that the people really weigh in and select their supervisor. That would be a great thing.
Well, if you think about it, with 25% of the vote and 5 candidates there, I mean, someone could literally win with 6 or 7% of the vote, a board seat. It's pretty incredible when you think about it. So
board members have incredible kind of impact on what happens within our communities. And so it's a very important seat. And I'm really proud of the fact that our registrar is one of the best in the nation. Neil Kelly is fantastic, and he will run a very clean election, and we'll get the count completed very quickly. We just think that this is really, it's a cornerstone of the American government, And we'd love to see people participate.
We do. So thanks again, and I'll thank our participants for joining us today. This will be a regular program of the 5 chambers, certainly, that have sponsored it today. Hopefully, maybe we'll add some more chambers going forward. So keep an eye out for future Update Orange County programming. I'm Steve Rosansky, President and CEO of the Newport Beach Chamber of Commerce, and you have a good rest of your week. Thank you. Take care.
Thank you very much.